Hello, my name is Dr. Anand. I'm going to be giving a informational session about medical marijuana and CBD and expanding acceptance and use by physicians. A little bit about myself. I am a physician, board certified in physical medicine and rehabilitation. I practice in Pittsburgh, Pennsylvania, and manage a practice where I manage patients with MS, chronic pain from spinal cord injuries, amputees, stroke patients. So a lot of spasticity, joint pains, and have been practicing here in Pittsburgh for 4 years. Otherwise, I've been practicing close to 10 years past residency. I have published in multiple peer-reviewed journals as well as books for physical medicine and rehab. I also incidentally have a company that produces CBD for my patients. So that is why I'm interested in giving a lecture and learning more about medical marijuana and CBD in the cannabis space. So some learning objectives. One, potentially, whatever potential benefits for medical marijuana and CBD are there for patients. Understanding the adverse effects and drug interactions of THC and CBD in patients, and reviewing current evidence and considering additional research needs to support the therapeutic use of THC and CBD. So a few of the discussion topics we'll be going over are the legal and research barriers with both CBD and medical marijuana, barriers to physicians prescribing for medical use, and physician and patient engagement to help us kind of expand that use and make it more acceptable. So first, regarding the legal and research barriers, there's definitely an increased role of cannabis in treating medical conditions, mostly spurred by patients rather than physicians. And there's a rapidly evolving attitude toward cannabis and expanding legalization for medical and recreational use. And I have these two slides here. One of them is regarding the cannabis retail estimates from 2018 to 2030, and you can see that it's just increasing in almost 54% each year, and that's a huge amount of growth every year. And it looks like it's almost close to $2 billion in 2020 for CBD sales. And again, for the one on the right, it shows total U.S. CBD sales from 2014 to 2020 expected growth, and it's exponential. So as more and more people are becoming accepting of it and there's more products on the market, the more physicians are going to experience and have to interact with CBD and medical marijuana and be able to provide patients some more education and appropriate response and guidance on how to use and possibly treat with these products. Differences between CBD and THC. This is a part that many physicians are actually kind of confused on, because in medical school and residency, wherever else in training, we really only see it as, weed or marijuana, and we know THC and CBD on a, chemical component standpoint, but in terms of what its potential effects, side effects, and where these actually come from, most of us are not as educated. So some basics are that, hemp products is mostly CBD heavy, and marijuana products are more THC heavy. They're both derived from the same cannabis sativa plant, and hemp is just less than 0.03% THC. And the THC is the one that's psychoactive, and CBD is not, which means it can cause, the high sensation, confusion, and feelings of euphoria. So and those are two very distinct things, which I'll come to at the next point regarding the differences between marijuana and hemp and its application currently for patients and legal problems with both. And, again, what are the real differences between CBD and THC? They're very similar types of components, but CBD acts at CB1 receptors, which those receptors produce a sense of relaxation and have applications for both pain and anxiety for both. What are the effects for both? Not fully understood. Some are helpful for pain relief, some are helpful for anxiety, some help for spasticity, and it's really deciphering which one helps more for certain things. Next up, for medical applications, how can they be applied? Are some, useful for migraine headaches? Are some useful for glaucoma? Which one and how much? And then also understanding the side effects of both of these. So next, on legal and research barriers are an adequate understanding for optimal intervention. So again, cannabis, marijuana is a Schedule I controlled substances. So that means there's different levels and barriers to what can be prescribed as a controlled substance. Schedule I is the most restrictive. That means there's really no reason to use it in medical practice. But the caveat is that obviously some have been studied, and we do have some THC and CBD products that are now Schedule III. That means they are still, restricted and require some, close management by a physician, but they're Schedule III. Whereas, Schedule II are common medications people know, such as Percocet and oxycodone and fentanyl. Schedule III are Marinol and even Epidiolex, which is a Schedule IV, so it's even less restrictive. So this is just some of the shifts in how clinicians need to understand that, there's THC products, CBD products, and which, how much restriction and how much control we need in being able to prescribe these to our patients. So that is something that will need to be worked on. And in this table, you can see that Epidiolex is a Schedule IV. It's used for treating very specific seizures. Marinol, which I actually do prescribe to patients with appetite and some pain-related issues, especially if they have cancer. So it's actually found in our hospitals. When I need to prescribe it, I can actually order it from a pharmacy. And then Casemat, which is a Schedule II medication, and it's not as widely used, but also to help with cancer-related chemotherapy, pain, and appetite. Now, Sativex is not approved for U.S. use, but there are ways to get around it. There are patients that are able to have access to it here in the U.S. Next up is understanding the disease states which it could be used for and could be beneficial for. So few of the things, again, there's so many areas that are not understood for both physicians and even just in general, because there's a lot to learn about, THC, CBD, and marijuana and all of its substrates. So one is, how is it metabolized in the body? One of the key enzymes in our body is called cytochrome P450. It's a liver enzyme that breaks down and metabolizes some of the drugs we use, seizure drugs, antibacterials or antibiotics, a lot of pain medication, so it can make it stronger or weaker. So you have to change your dosing when you're using CBD and marijuana products. So that's, always a concern. We don't know how much to modify it and where, we can add these medications safely into a patient's regimen. So in this key group of enzymes, metabolizes more than 60% of marketed meds. So that's a big consideration to see the cross-reactivity for physicians to see, is it safe enough to give to my patients and how much? So you can see I have some tables here that are drug-drug interactions for THC and CBD, and just CBD alone. And they're all pretty similar, especially for antidepressants or any CNS depressant medication. That's the main thing that we have to look out for. So you can see on the table to the right for CBD, other substrates, CBDA, CBG, THCV, they all have different mechanisms and different things that they do to the body. Some are antibacterial, some relieve anxiety, some promote gut bone growth, some treat fungal infection, some help with inhibit cancer cell growth. So there's so many options, and there's a lot of things to learn about it going forward. And there's just, a lot that patients could probably teach a physician. Next one, as I mentioned before, the drug-drug interaction is really the biggest concern. Most patients that are looking for medical use are on complex medications. Some are on, very expensive and dangerous chemotherapy medications. Most patients that, for my personal use, want to use it to reduce their opioids or get off their opioids. And I always worry, if you're using it, how is it going to affect it? Is it going to make it so that you're feeling more drowsy? Is it going to aggravate your stomach? It's kind of hard to tell, except with experience and, managing these patients carefully. That's just another thing to think about. And have two tables, one on the left is just talking about the potential side effects with the antibiotics, sedatives, and anti-cancer ones. And the table on the right, there's just so many different medications such as Haldol, Cymbalta, Valium, and heart rate medications and blood thinners that we need to look out for. So next are research and future of medical marijuana and CBD. So again, I mentioned there's different receptors in the body that react differently to these compounds. They help with different things. Some receptors help with, as I mentioned, anxiety, pain, spasms, which are CB1 and CB2 receptors. THC mostly reacts at CB1, and that causes the psychoactive component. And CBD has little activity there, but mostly activates CB2 receptors. So there's different effects of the THC and CBD, even though they do have some overall similar components in being able to help patients. Most of them are the anti-inflammatory and immunomodular effects. Next, cardiovascular effects. There is a lot of stuff to be studied there. It might decrease blood pressure, and so there are some studies that show that it might influence myocardial infarcts, which are heart attacks. Next, for appetite, some stimulate appetite, and some slow gut motility, which could be very helpful in someone with GI issues such as Crohn's or ulcerative colitis. So for carcinogenesis, want to look at patients that might have some malignancy. There are some studies that it could potentially help with lung cancer. Again, very prelim studies. And then for ophthalmologic conditions, it can lower intraocular pressure and glaucoma, which is one of the main conditions that we see for medical marijuana use. Next up, legalization and classification. So again, now marijuana remains a Schedule I substance. So that means doing research on it is very limited, very difficult to get a hold of, very difficult to get, university institutions and, physicians and patients to want to participate in any of these studies. For example, some other, Schedule I substances are heroin, LSD, and ecstasy outside of marijuana. And hemp-based CBD, as I mentioned, is very confusing because the FDA doesn't validate, or outside of one or two prescription medications, it hasn't really given a clear-all or guidance on how to kind of go about doing CBD research as well. A lot of the CBD research is done with pure CBD, not necessarily hemp oils, so the consistency is also lacking. And for marijuana, 36 states, including DC, Guam, Puerto Rico, and U.S. Virgin Islands, have approved it and is available. So that's more than 50% of the U.S. that has this available to them. But again, there's definitely not 50% of physicians that are prescribing it or can give guidance on it. So this is the legal aspects to prescribing both medical marijuana and CBD. Where medical marijuana is legal, doctors can write a recommendation. You cannot write a prescription. Like when you come to the office and your ear is aching, you write an antibiotic. I can't hand you a prescription. It is just a recommendation saying, yes, you are someone that is recommended to be a candidate for medical marijuana, but I can't tell you how much. I can't tell you how to use it. It's not a prescription. Now, there was some concern about how this is done because there was a court order from the U.S. Court of Appeals showing that physicians discussing potential benefits is freedom of speech. So that at least rule and support was given. Again, each state has different conditions approved. There's limited clarity and continued confusion on what states approve which diagnosis, as this changes frequently. And for doctors, they're really reluctant to say, oh, you should use a drop, you should use a cream. I can't tell you what dosing, I can't tell you which strain because it's all so vague and there's no consistency between dispensary and physicians. And some states do require physician and patient clinical relationships before prescribing. Again, if you are trying to get it from a physician that doesn't believe in it or doesn't think it's for you, you're kind of stuck. You have to end up trying to find a new physician that might be willing to prescribe medical marijuana or discuss CBD with you. And there's also limited physician training on laws and dosing of both CBD and medical marijuana. So most common questions for physicians are, how do you regulate it? How do you recommend it? How do you dispense it? Registering patients, finding out exactly what they're using. Those can be quite confusing to physicians. And examples of diagnoses for states, these are some of the diagnoses that are approved for medical marijuana. And I live in Pennsylvania. Currently, there's 23 qualifying conditions, but in 2018, there are 17. We cannot prescribe edibles. Previously, smoking was prohibited. Now there's flower use. So again, things are just rapidly changing, and it's another thing to keep up with. But we're not, given this literature usually like we are with new medications and new drugs. I'm not reading it in, JAMA every month about what the new updates in medical marijuana are or CBD. So for THC and medical marijuana, it's the pharmacists and the dispensaries that actually have most control over what to help a patient with, which medications to give. A lot of states require pharmacists to consult with the patients. And again, the THC-CBD ratios in various strains are inconsistent. Some states allow certain things and some don't allow others. So a lot of confusion there. Some other barriers are CBD research and questions that require further investigation. During the approval process for Epidiolex, there are some potential side effects, and this is what everyone's kind of concerned about when they read about CBD. Liver injury, what is the dosing that causes it? Interactions with other medications, the increased risk of sedation causing drowsiness, and can they mix with medications that treat your anxiety and panic and sleep disorders, such as Ambien? Do they change your alertness? Do they cause appetite issues? And the Epidiolex is known to cause some diarrhea. So those are some questions. So what happens with prolonged use of CBD and THC? What happens with certain dosing? We don't know what the triggers are. What is the best way to take it? Should someone be smoking it? Probably not. And then sit for physicians. And then orally, is that the best way, or topical? Those are still to be understood. What happens in developing brain? How does it affect it? How does it affect breastfeeding moms and developing babies and breastfed babies? And does CBD affect male fertility? There is some studies that show that marijuana use can affect male fertility. Next, there's just an abundance of products out on the market that we can choose from. I honestly don't even know how many there are. I'm sure there's literally hundreds coming out every month. And most of those are put to market with little or no research. There's issues on trust, quality, and consistency of products. Many times the dosage is not known or verified by a third party. What are the side effects? Again, which is the best form? Do you take the pill version? Do you take the tincture? Do you use a cream? A lot of people and physicians and patients see it as recreational. They don't maybe consider it as a therapeutic product. And will we prescribe? I know as a physician, I don't prescribe what's unknown or could be potentially damaging or unsafe for a patient. And people, where are you getting this product from? Amazon, unknown markets, your neighbor, and even for pets, these are the example bottles of just what's even out there for your pet, and for human use, it's even more. And obviously, for my pet, I would be concerned about what I'm putting in them, and just like for humans, what are we putting into our bodies? So, how do we kind of come to a solution? How do we make this more acceptable and solve some of these key issues? One is that we need more research that FDA can back and approve, an IRB, which means Independent Review Board, which is a third party that makes sure your research is following all the guidelines. So physicians need to be educated on the current benefits and the risks, side effects, and all of this. And patients need to advocate for themselves. Sometimes they need to see that research and bring it to their physicians to say, I want you to look at this and tell me what you think. That's one of the things I would recommend. And, issues that further need, engagement is that the research that's out there, there's not a lot, it's not qualified, and results in current patients are very minimal. Most of them are animal-based or just based on the biology of it and the chemistry rather than in patients. Research and tracking symptoms, that what symptoms and what diagnosis could potentially benefit. There's skin conditions, diabetes, hypertension. That's a whole new realm that most patients don't even realize, or physicians don't realize that it could help. The stigmatism, marijuana versus CBD, Schedule 1, Schedule 3, what's the legality of it? And again, with dosing, how much? Is this the right dosing? Is it the right amount? Do I take it once a day, twice a day? So other solutions are, patients rely on physicians for information on THC and CBD products, and physicians don't know, and then they rely on, patients, and it's a taboo topic. So a lot of patients won't even bring it up because they're nervous that their physician's going to judge them for it. And big pharma, they can come into physicians' offices, they can come into medical conferences and say, here, learn about my drug. These are all the side effect profiles. This is why you should use it. This is what you need to worry about. But marijuana and CBD companies don't have that access to physicians and to the medical community in a whole. They're not approaching them saying, can you learn about this and see what its potential for your patients could be? And this is, in our experience, what we've known as side effects. They don't have that opportunity. So there's a huge barrier that needs to be crossed. There needs to be better operators who produce, quality ingredients and quality products, and maybe can promote some research and allow it to be, presented to patients and medical providers. So that was kind of where I came up with my own solution after many years of patients asking me about alternatives for marijuana and CBD. And if you asked me 5 years ago, I would have said absolutely not. But then seeing patients presenting things to me, presenting literature, presenting their products, and me taking a closer look and seeing that some patients were doing very well on these products. So then I, started to prescribe medical marijuana and notice improvement in my patients. The ones that didn't want to pursue marijuana or couldn't use it for medical reasons, we looked into CBD. And then we started testing the products and seeing the inconsistencies. And again, I didn't know where they were getting it from or what the lab data showed. So I teamed up with a group called Hemp Synergistics, and they helped produce products for me that I formulated the dosing based on current research that's out there, and how much is needed for transport for skin-based therapy, for oral tincture-based, and produced a pill-based form that helps bypass the gut so it's more bioavailable. So I started using that. Currently, right now, we're in the process of working with the FDA and IRB to do some research studies on these and seeing how my patients on chronic opioid therapies do with this product and see if they're able to reduce any of their opioid use. So hopefully this will allow some more clarity and acceptance into the medical community if there is products that fit all those criteria that physicians are looking for. So all my patients have access to this product, and I'm able to oversee their medical care, medications while they're using it. So I think they're seeing a lot of good effects so far, and I'm hoping that the cannabis and CBD industry in the future will be able to do more things like this and provide more opportunities for patients to get relief. And this last slide is the products that I'm currently allowing my patients to use and seeing how they're doing on it and that we're doing our research on. I think that's it. Thank you all for your time, and appreciate being a part of this conference.